Do not forget that a patient with thoracic pain and shock may not be with a myocardial infarction, but with a pulmonary embolism. Like this patient here, where his transthoracic echo showed a thrombus in the pulmonary artery in the short X at the base. But this demonstration is very seldom seen in a transthoracic echo. The TEE echo may show it better, as seen in this patient with a thrombus in the right pulmonary artery. But there are other echo signs that help to make this diagnosis of pulmonary embolus. Like seen in this example here, there is a dilated right ventricle with diffuse or akinetic walls, occasionally, except for the apical region, the so-called McConnell's sign. The right ventricle seems to be stunned. The TEE may detect the thrombus in the right pulmonary artery, as seen in this patient, but would seal the diagnosis. So here is another case. A dilated right ventricle showing diffuse hypokinetic walls. This is very suggestive of pulmonary embolism. Look at this case, a dilated right ventricle with hypokinetic walls. Here is an apical view. There is systolic overload of the right ventricle, as seen by this IV septum that flattens the left ventricle in diastole as well as during systole. In this patient, there is a thrombus right here in the pulmonary artery truncus and also the left pulmonary artery. TEE shows a dilated right atrium with high intra-atrial pressure. Look at the displacement of the atrial septum toward the left atrium. A diffuse hypokinesis of the right ventricle with a thrombus also in the right pulmonary artery. In this situation, if there is tricuspid regurgitation, we will detect pulmonary arterial hypertension, analyzing the high velocity of the tricuspid regurgitation.